Except for respiratory arrest, the symptoms of sleep apnea include severe persistent daytime sleepiness, headaches mainly in the morning, sore throat, dry mouth and throat after waking up. Sleep apnea also affects the cognitive functions of the brain. This is a clear defective memory and decreased alertness, anxiety, irritability, and depression. Also, patients note a decrease in libido, the development of impotence, and frequent urination at night. Amid snoring, chronic diseases are more severe. Now, when you hear snoring, you will know that this is a cry for help from an oxygen-deficient organism. A snoring patient does not feel and is not aware of respiratory arrests, and it is at these moments that the risk of developing a stroke, heart attack, and sudden death syndrome is highest. Not only adults suffer from sleep apnea and its consequences, often the symptoms of this disease are also noticed in young children. Some children are prone to short-term respiratory arrest, so-called nocturnal sleep apnea or sleep snoring. It is associated with the immaturity of the complex mechanisms of excitation of the respiratory center. If your baby has this problem, you should be well informed about it. Sudden sleep apnea in infants occupies a significant place in the causes of death of infants under the age of 1 year. Such sleep apnea may occur due to imperfection of the central regulation of breathing in newborns, especially premature babies. It is also exacerbated by pneumonia, upper airway hematomas, and rhinitis. For healthy children, a 10 to 15 second breath hold is not so rare. If it happens, you have to gently touch your baby. The child will snort and breathing will resume. Don't worry if your baby has sleep apnea. Most often, this problem occurs in premature babies and children with low birth weight. Children usually outgrow this condition. The occurrence of sudden sleep apnea in newborns with an underdeveloped central nervous system can also contribute to overheating in violation of the normal thermal regime. If your child has sleep apnea, make notes about how often and how long it holds its breath. Discuss the situation with your pediatrician. Some parents use various kinds of warning systems and monitors in such cases. If your doctor considers the condition dangerous, he or she will help to find a solution to the issue. According to a group of American scientists who published the results of their work in a pediatrics journal, hyperactivity and other behavioral problems in children may also be due to difficulty in nasal breathing during sleep at an early age. The study authors analyzed information about the health and behavior of 11,000 children aged 6 months to 7 years. Children who snored, sniffled, breathed through their mouths, or suffered from sleep apnea in their first year of life and older were found to have a 69% increased risk of developing attention deficit hyperactivity disorder and other behavioral and emotional problems at the age of 7. Moreover, the probability of developing attention deficit disorder remains increased by 40 to 50% in comparison with children who breathed well in their sleep, even if the child was able to get rid of difficult nasal breathing before the age of 1.5 years. Researchers suggest that the lack of oxygen due to impaired breathing during sleep negatively affects the developing brain. In addition, the quality of the child's sleep is deteriorating, which also negatively affects the development of various regions of the brain and the chemical balance in it. Scientists and doctors around the world take the problem of sleep apnea very seriously, and they are not in the mood for jokes about snoring. Sleep apnea is now regarded as one of the leading causes of disability and mortality in the world. The mortality rate of patients from pure sleep apnea is 6 to 8%, while it is important to note that mortality from diseases associated with sleep apnea syndrome increases significantly in the absence of timely diagnosis and effective therapy. According to the researchers, a significant proportion of the nocturnal deaths that were attributed to sudden cardiac death are actually associated with sleep apnea, and thus the cumulative mortality from this syndrome can be as high as 37%. American researchers found that among people aged 30 to 60 who did not consider themselves sick, this syndrome was detected in 9% of women and 24% of men, and in those over 60, the percentage ranged from 27 to 73%, while in men it is observed much more often than in women. Clinical studies data reveal the relationship of sleep apnea with the development of coronary heart disease, arterial hypertension, that is, high blood pressure. A study of the impact of sleep apnea on the likelihood of sudden cardiac death analyzed data from 10,701 Minnesota residents over 18 who were sent to the Mayo Clinic for polysomnography between 1987 to 2003. Polysomnography is a widely used method for the study of respiratory disorders that occur during sleep. Obstructive sleep apnea syndrome was established when more than 5 episodes of apnea were detected in 1 hour of sleep. The average age of the patients was 53 years, and 68% of the participants were men. The follow-up period for participants ranged from 5 to 15 years. During the observation period, 121 cases of sudden cardiac death were registered. This study found that moderate and severe forms of sleep apnea with a significant decrease in blood oxygen are prerequisites for an increased risk of sudden cardiac death. Doctors warn that sudden death from a heart attack is most likely if you are over 60, have 20 or more episodes of sleep apnea per hour, and have blood oxygen levels of less than 78% while you sleep. In such patients, the risk of sudden cardiac death is almost 2 times higher than in individuals without this type of respiratory disorder. Another study found that people with severe sleep apnea, all things being equal, were 3 times more likely to die over an 18-year period than those without the syndrome. A 2007 study by the Yale School of Medicine warns that sleep apnea can increase the chance of a heart attack or death by 30% within 4 to 5 years. A 2010 study published in the American Journal of Respiratory and Critical Care found that sleep apnea can double or triple the risk of stroke. According to a 2011 medical review, up to 60% of people with cardiac distress also have sleep apnea. Adults in the study who were also treated for sleep apnea had a better 2-year survival rate than those who were not treated. Sleep apnea can cause or worsen heart disease. According to a 2013 study published in the Journal of the American College of Cardiology, people with sleep apnea have a higher risk of dying from related heart complications. A study has shown that sleep apnea can increase the risk of sudden cardiac death by 2 to 3 times. The National Sleep Foundation, NSF, founded in the USA in 1990, notes that people with sleep apnea and atrial fibrillation, that is, an irregular heart rhythm, must undergo treatment for both pathologies, and only in this case they will be successful in further heart treatment. If sleep apnea is left untreated, the likelihood of the need for further treatment for atrial fibrillation rises to 80%. Another study at Yale University linked sleep apnea and type 2 diabetes. Adults with sleep apnea have been found to be more than twice as likely to develop diabetes than people without sleep apnea. There is growing evidence that sleep apnea affects glucose metabolism, leading to insulin resistance, that is, type 2 diabetes and weight gain. This is due to the stress that occurs during sleep apnea, which contributes to the development of diabetes. However, the authors of the study from the Mayo Clinic, Rochester, Minnesota, USA, believe that there is no reason to panic, since sleep apnea is easily treatable. However, according to scientists, it would actually be more reasonable to use the obtained data to increase the alertness of people in relation to severe forms of sleep apnea. Besides, it's safe to assume that milder forms of sleep apnea may contribute to the occurrence of cardiovascular pathology. The results of the study were published in 2013 in the Journal of the American College of Cardiology. Throw in constant fatigue from lack of sleep, which causes memory problems, anxiety, and depression. To be continued in the next episode. Stay tuned.